Certainly, there's pharmacological strategies that are kind of like tricks that we use in headache medicine treatment. You might be prescribed acetazolamide that started maybe a day before, and you continue it a couple of days after. So I have recommended this strategy for some of my patients that are very sensitive to barometric pressure changes. I'll have them, if they can identify that it's coming. Another sort of medication that is used sometimes, it's spironolactone. Topiramate is similar to acetazolamide in one aspect, in terms of it also has a mechanism of decreasing the pressure in the head. It also has other mechanisms that treat migraines. So you might get a dual effect being on topiramate. So one of the recommendations that I give during fall and spring is to just take an antihistamine. My personal preference is cetirizine, and I do like that because it does work well. It is a little bit more sedating than loratadine, but cetirizine has a unique mechanism where it works in the early phase of an allergic reaction, as well as a late phase of an allergic reaction that occurs 11 hours later. And then, there are certainly nasal sprays you can do, like even nasal steroids that prevent the allergic response. When you've, let's say, used your weather app to track like the barometric pressure is changing, you can certainly try taking a medication that has a longer duration of action, whether it's a Gepant, or there are some longer acting triptans that you can use as well too. So naratriptan is a longer acting triptan. And then you could also pair it with the longer acting anti-inflammatory medicines. So if you know that, if you have an immediate headache, the anti-inflammatory medicines like ibuprofen that come in a liquid gel may tend to work a little bit faster. So you can certainly use that ahead of time. And you can do it, for a few days in a row, pre and post weather change. And there are more things coming. So there's constant research that's ongoing. So I want to just leave you with some hope that this is treatable.